Hi Andy, this is Dr. P. Ravi Kiran, General Physician and Diabetologist at Onus Robotics Hospital, Champapet. As a part of corporate social responsibility, this is a part of webinar program where we want to teach our people, our clients and our audience the role of diabetes and the role of pancreas in the causing of diabetes. So let's get into the details. Why is this session important? People, especially one in every four individuals in your country, it amounts to about 30 to 40 crores of the Indian population are the risk of diabetes or already pre-diabetic. So many of those population don't know the root cause and they feel diabetes is just one problem that which can never go up. But the truth is very far different from the myth. Diabetes can be fully reversed, completely reversed, and can be led a normal life as a normal individuals. Understanding how pancreas works helps patient accept better. Beta cell functions determines if diabetes is reversible, controllable, or needs insulin. The beta cells are some of the major cells of pancreas which secrete insulin and may play a major role in diabetes control. Early detection protects beta cells and prevent the long-term damage and help us attain diabetes reversal. Where is the pancreas located? Pancreas is a long, flat gland. It is approximately 6 inches in size, located behind the stomach. It has two major functions. Digestive function, also called as exocrine function, and hormone function, also called as endocrine function. The endocrine function has the release of the major hormones like insulin, glucagon, etc., which control the blood sugar values in the normal range. Only 1 to 2% of the pancreas is endocrine, but it controls the entire blood sugar of the body. Islets of Langerhans. Islets are tiny clusters of protein cells which have multiple cells, beta cells, alpha cells, delta cells, and PP cells. Of them, the beta cells are the most important thing, which make about 60 to 70% of the islets and they produce the insulin. The entire body's insulin is produced from the beta cells, whereas alpha cells, which produce glucagon, this glucagon counteracts the insulin. Whatever the role of insulin is, that's exact opposite of the glucagon. Insulin makes sure that the cells take up the blood sugars and reduces the blood sugar values, whereas glucagon does the same. Glucagon increases the blood sugar levels, and that's why glucagon injection has been used as a treatment in people who have insulin toxicity or more insulin dosages. Delta cells produce somatostatin, pancreatic hormone. There are some hormones which helps in normal bodily functions, but our main core interest area is beta cells, which produce insulin. Beta cells are a main focus because their death or dysfunction causes diabetes. Diabetes is caused by beta cell dysfunction, which is secondary to insulin resistance. What do beta cells do? Beta cells detect blood glucose levels, release insulin when the sugar rises, maintain glucose balance after meals. Beta cells communicate with the liver, muscles, and fat cells. There is a triad of liver, muscles, and fat cells where the sugar control happens. Also, in earlier phases, whenever there is some damage to the beta cells, there would be a definite beta cell regeneration to some extent, but it doesn't happen in the late diabetes. That's why we especially focus on diabetes reversal. Whenever we talk about diabetes reversal, we'll inform patients that early pre-diabetes or early type 2 diabetes within the first 5 years have the highest priority of becoming diabetic reversal because after some extent the beta cells lose the function of regeneration and there would be some need for medications to control their diabetes. So diabetes reversal happens in the majority of the patients who are within the 5 years of type 2 diabetes or a pre-diabetic. How beta cells release insulin? You eat food, the carbohydrates or the glucose enter the blood. Beta cells sense the glucose. There is an opening of calcium channels. Within the beta cells, insulin is produced. Insulin enters the bloodstream and reduces sugar. So the function of insulin is to reduce the blood sugar. Think of beta cells like sugar sensors plus insulin factors. Whenever there is a sugar in the blood, the insulin beta cells recognize it and they produce insulin which they already produced. First phase and second phase insulin release. First phase insulin is the quick release which happens in the 10 minutes where it controls the immediate post-meal spike. Whenever you consume the food, there will be a definite post-meal spike in the initial phase, which is controlled by the first phase insulin. It's lost early in type 2 diabetes. This is why we observe that the postprandial sugar equations rise by more than 100 to 200. నార్మల్గా ఒక పేషెంట్ నార్మల్ ఫుడ్ తిన్నప్పుడు ఫాస్టింగ్లో వాళ్ళ షుగర్స్ 140 ఉంటే వాళ్ళు తిన్న తర్వాత వాళ్ళ షుగర్స్ 140 దాకా రైజ్ అవుతాయి. దర్ ఇస్ 30 to 40% రైజ్ ఇస్ ద నార్మల్ ఫినామినా. Whereas in type 2 diabetes, where there is a loss of first phase insulin, they consume the normal quantity of food, but their sugar rises up to somewhere around 100 to 150 times. ఫాస్టింగ్ షుగర్స్ వాళ్ళు 130 ఉంటే వాళ్ళు నార్మల్ పీపుల్ తిన్నంత క్వాంటిటీ తింటారు, కానీ బికాస్ ఆఫ్ ద లాస్ ఆఫ్ ఫస్ట్ ఫేజ్ ఇన్సులిన్ దేర్ షుగర్ స్పైక్స్ నియర్లీ బై 100 to 120 పాయింట్స్. ఇనిషియల్గా 150 ఉంటుంది, తిన్న తర్వాత 260 270 దాకా వెళ్ళిపోతుంది. దట్ ఈస్ బికాస్ లాస్ ఆఫ్ ఇన్సులిన్ సెక్రేషన్. సెకండ్ ఫేజ్ ఇన్సులిన్ రిలీజ్ ఆర్ హెల్ప్ కాంప్లెక్స్ మీల్స్, అంటే మనం ప్రోటీన్ కానివ్వండి, కాంప్లెక్స్ కార్బోహైడ్రేట్స్ కానివ్వండి, ఫైబర్స్ కానివ్వండి, ఫ్యాట్ కానీ తిన్నప్పుడు దిస్ సస్టైన్ రిలీజ్ సెకండ్ ఫేజ్ ఇన్సులిన్ ప్రొటెక్ట్స్ ఆర్ షుగర్స్ ఫ్రమ్ రైజింగ్ అప్. In these, when this is lost, then there is complete haphazard control of diabetes or loss of diabetes, and it becomes uncontrolled diabetes. How beta cells communicate with the body. In liver, insulin stops liver from producing excess glucose, because whenever the body is in the fed stage, అంటే మనం ఎప్పుడైతే తినేసి మన బాడీలో షుగర్ రేజ్ అవుతుందో అప్పుడే ఇన్సులిన్ ప్రొడ్యూస్ అవుతుంది. సో ఇన్సులిన్ బాడీలో ప్రొడ్యూస్ అవుతుంది అంటే దేర్ ఆర్ ఆల్రెడీ హై షుగర్స్. సో ఇన్సులిన్ కమ్స్ అండ్ స్టాప్స్ ద లివర్ ఫ్రమ్ ప్రొడ్యూసింగ్ న్యూ గ్లూకోజ్. In insulin resistance, this function is lost. Therefore, they release excess glucose even when the patient is in the post-fed state. Insulin resistance causes liver to stop responding to insulin. In muscles, insulin allows glucose entry, and when the glucose enters the cell, it becomes into energy. In fat cells, insulin helps store excess energy, prevents fat breakdown, avoids ketones. What damages beta cells? The main cause, glucotoxicity, lipotoxicity. రెండు దీస్ ఆర్ కాస్. ఈ రెండింటి మీరు చూడండి ఎక్కువ ఉంటుంది. slowly as they are able to as the sugars come down, వాళ్ళ నీడ్ ఫర్ టాబ్లెట్స్ కానీ ఇన్సులిన్ కానీ తగ్గుతుంది. ఎందుకంటే బికాస్ హై గ్లూకోజ్ లెవెల్స్ అండ్ హై ఫ్యాట్ లెవెల్స్ ఆర్ టాక్సిక్ టు బీటా సెల్స్, అంటే దే లిటరల్లీ కిల్ ద బీటా సెల్స్. సో ఇనిషియల్గా ఎక్కువ ఉండడం వల్ల బీటా సెల్స్ సరిగ్గా పనిచేయకపోవడం వల్ల మనకి ఎక్కువ అమౌంట్ ఆఫ్ ఇన్సులిన్ కానీ ఎక్కువ అమౌంట్ ఆఫ్ టాబ్లెట్స్ కానీ అవసరం పడుతూ యాజ్ we slowly reduce the sugars and the cholesterol, these toxic levels come down and the pancreas and the beta cells are able to function properly. The main causes are high sugars and high fat, chronic inflammation in form of some illnesses, autoimmune diseases, genetics, obesity-driven insulin resistance, viral infections, and long-term mental stress. Stress, sleep, lack of sleep, genetics, high sugars, high processed foods, these all play a major role in causing damage to beta cells and in the causes of diabetes. How much beta cell function is needed? Normal person, 100% of the function is present in normal person, whereas in pre-diabetics, 50 to 60% of the function is left. And in majority of the times, whenever we identify the patient in pre-diabetes and treat them properly with the reduction of insulin resistance, there may be a majority of the regain of, even if may not be 100% regain of function, at least majority of the function would be regained. Whereas in early type 2 diabetes, only 40 to 50% of the beta cells are functioning. In long-standing diabetes, it becomes less than 20%. Up to the early type 2 phase, till this phase, complete diabetes reversal and reverse and regeneration of beta cell to some extent is possible. Whereas from here there is no reversal. There is a definitive need for insulin or medication for their lifetime. In long-standing diabetes, it's less than 20%. In type 1 diabetes, secondary to the autoimmune attacks, 0 to 5%. Once beta cell functions falls below 20 to 30%, insulin becomes necessary. Pancreas in prediabetes versus type 2 diabetes. In prediabetes, beta cells are working hard, produces the extra insulin to cover the insulin resistance, and it can be reversed with lifestyle changes. In type 2 diabetes, when a full-blown diabetes, beta cells become exhausted, first phase insulin secretion is lost, eventually insulin levels drop, reverse possible early, then becomes hard. Because in initial type 2 diabetes, over the first few years, a reversal can be done, whereas in the later phases, the reversal is not possible. Pancreas in MODY. MODY is monogenic diabetes, maturity onset diabetes of young, weight occurs secondary to genetic defects, single gene defects, beta cell dysfunction without insulin resistance, common types, GCK gene is involved, HFN, there are multiple genes where diagnosis is done by only genetic testing and there is no issue with the insulin resistance. How lifestyle protects beta cells? First, diet. Low refined carbs, high fiber diet, high fiber, balanced proteins and controlled portions. Portion control is the most important thing you have to do for yourselves to reverse your diabetes. Your diabetes reversal starts from portion control and it doesn't start from the gym or the workouts you do. Diabetes reversal can be only attained if you are doing portion control. Low refined carbs, high fiber, balanced portion, controlled portions. Exercise makes cells utilize glucose without needing high insulin. So the insulin is needed to push the sugars into the cell, but cells utilize glucose without the need for insulin. This is one of the major rules which helps us in reversing diabetes. Controlled portions with post-meal walking is the most important prerequisite thing for us to reverse diabetes. Also, it reduces load on beta cells. Weight loss. Even if you lose 10% of your weight, it greatly improves insulin sensitivity. If your weight is at 100 kilos, even if you lose at least 10 kilos, you would have a definite, very good results that would help us reverse diabetes. Sleep. Poor sleep reduces beta cell efficiency. Poor sleep reduces beta cell efficiency. Stress management. Whenever a person is under stress, there would be increased cortisol secretion, which causes more sugars and more beta cell strain. Medications then protect beta cells. Metformin. Metformin is the first line drug. It has been the first line drug over the past 30 to 40 years. It would remain the first line drug over the next few 10 to 30, 20 to 30 years. It reduces glucose, liver output glucose, reduces less strain on beta cells. DPP-4 inhibitors, GLP-1 agonists. These are the newer wonder drugs which have been utilized in all extents in diabetes, in obesity, in metabolic syndrome, in PCOS. Excellent results. SGLT2 inhibitors and insulin therapy. Temporary insulin can help beta cells recover. This is the reason why whenever we see a patient with high sugars where the HbA1c is more than 12, more than 10, we advise the patients to be started on temporary insulin so that the beta cells are recover faster and his need for multiple medications reduces faster when beta cells are beyond recovery. But long-standing diabetes. Whenever the diabetes is of more than 10 to 15 year duration, the beta cells are already damaged beyond repair. These are the times when the diabetes reversal is not possible to a complete extent. C-peptide very low, repeated high sugars, autoimmune dissection. In these cases, insulin is essential. Tight control prevents complications. CGM helps monitoring trends. Myth about pancreas and diabetes. The myth one is pancreas stop working suddenly, and that's why the patient developed diabetes on a full extent. The truth is, beta cell decline happens slowly over years or 2 years. Sometimes even 10 years of the time is needed for the beta cells to be destroyed. Only sugar harms the body is the second most common myth. Always remember, sugar is not always the whole sole culprit. Sleep deprivation, stress, obesity, alcohol, irregular lifestyle, and irregular diet changes all damage beta cells. Of them, sugar is one of the factors which damages beta cells. Tablets fix everything. Always remember, tablets never fix anything. Tablets only help us be better. So, for us to reverse diabetes or to reverse control diabetes, lifestyle, early diagnosis, and interventions are needed to control diabetes, and only diet is never and only medications is never sufficient to control diabetes. Summary: patients control blood sugar via hormones. Beta cells release insulin after meals. Their dysfunction leads to prediabetes and diabetes. Type 1 and LADA are autoimmune beta cell discipline called type 1 and latent autoimmune diabetes of adults. These two are autoimmune conditions where the beta cells get destroyed and they will completely dependent on insulin. Type 2 is insulin resistance with beta cell burnout. Lifestyle massively impacts beta cell health. You do proper diet changes, proper lifestyle changes, there will be a definite diabetes reversal. That's what we at Onus Robotic Hospital strive to provide to the patients. Early treatment protects pancreas for years. So always remember, early detection through screening and controlling the sugars with diet, lifestyle, stress, and sleep management is of our utmost priority. We at Onus Robotics Hospital provide you free diet and lifestyle advices for diabetes reversal and help you maintain diabetes under control or completely reverse your diabetes and lead a diabetes-free life. Thank you.